Medicare Part A and B. Medicare Part A is hospital, and hospital only. Medicare Part B is outpatient services. For anybody that has a Medicare card, all it says is hospital, Part A hospital, and Part B medical. But what does medical mean? Medical doesn't mean anything by itself. It should say outpatient. So A is hospital, B would be the emergency room, outpatient services, doctors, lab, office calls, anything like that. If you've paid in 10 years to the system, or a spouse has paid 10 years into the system, then there's no charge for Medicare Part A. If you have not paid into the system, or you've immigrated and not worked 10 years before retiring, or we have people that come in the office, they've been paid cash under the table their whole career, and now they're Medicare age, and these things happen on occasion. You can buy Part A, but it's about $450 a month. So Part B, you do pay for it. And later we'll talk about income limits, but the fact is Part B is means tested. So just really simply, income is over $85,000 and you're single, you pay more for Part B. If your income is over $170,000 and you're married filing jointly, you pay more for Part B. And I had a woman after my class say, you really need to tell everybody that the income test is 2-year retroactive. So she and her husband went on Medicare this year, but in 2016 they took a bunch of money out of an IRA. So they're paying the maximum $428 a month for Part B, when she could have kept him on her group health plan a little bit longer for free. So she wanted to make sure we tell everybody that it's a continuous 2-year look back for your income.
Is it just earned income, or is it any revenue source?
It's your adjusted gross income. Yeah, so people, retire and sell their business or take a bunch of money out of their 401k to pay off their house or whatever it might be. If you have some big income event, then 2 years later you're going to pay a lot more for your Medicare Part B. Yes?
So will Medicare automatically deduct the amount of the premium if your income goes down, or do you have to do something proactively and tell them?
They'll do it automatically because by the time 2 years go by, they have your tax return and everything's on record there.
Okay.
So it automatically gets adjusted. So if you have deferred Social Security and you go on Medicare, then you will be billed quarterly. And for most people turning 65 now, it's $134 a month. So you'd be billed $402 a quarter. But if you're taking Social Security, Medicare Part B premiums are always withheld from your monthly deposit automatically. So here's the income limits. If you're single and make over $85,000, you can pay as much as $428.60 a month.
A month?
Yeah, instead of $134. And that's per person. So one thing that isn't in the slide deck is that Medicare plans are always per person. There's no family or husband couple Medicare plan. So oftentimes each spouse might want a completely different type of plan because of different needs. Other couples come into the office and say, let's just keep it simple, let's get the same plan so we can understand each other's coverage. But it's always whatever's right for you could be different than what's right for your spouse.